it's Dr. Noel Williams, Optimal Health Associates. I'm going to be going over a COVID-19 update. It's March 16th, by the way, 2020. I will get out in front of the fact that I'm now doing these all the time. I'll try to make this one shorter. I'll do my best to keep it about 4 to 5 minutes. But I'm a rambler, so you have to deal with it. I'll also speak louder for those people who've texted, emailed, etc. about me not speaking loudly. I am a soft talker when I'm with people, so it just doesn't change when I'm talking to a screen. So the COVID-19 update today is Trump addressed the country and said we're to do self-voluntary isolation. The point of that is COVID-19 is out of control. And since it's out of control, we need to start quarantining ourselves, self-isolating, doing small groups, doing all the things that the federal government suggested today. The problem with that is they realize at a federal government level that it isn't going to work because Americans are too smart for themselves and aren't going to listen to their government at this point. So what's going to happen is we're going to get about 7 days further down the road, and we're going to go from about 4,000 positives to about 20,000 to 25,000 positives. And I think that will be the magic number for Trump to say we have to do mandatory quarantining and isolation. It might take 50,000, but I think 25,000 should do the job. Plus the fact that we need to get the National Guard mobilized now. The word here in Oklahoma is they're on a 36-hour time frame for being activated. And once they get activated, it's going to take them about a week to get logistically centered, get hospital stuff taken care of, get supplies out, and start getting into a rhythm of patrolling. And at that point, somewhere between, I think, 7 days from now and 10 days from now, we'll all be under a quarantine issue. So just be ready for that. Understand what's going on. They're not going to suddenly give a quarantine. The country's too big. We're two independent people. We are not a communist country like China where they can just cut it off and say, you're in your house, and then they solder you into it. We're Americans, so we're slow moving and slow thinking in terms of accepting information and advice from others, which is fine. I always remember Missouri, it's the show me state, and the United States needs to understand how serious this is, and we're not there yet. And speaking of that, if you have a friend or a relative who thinks this is all baloney, send them this video tonight and let them listen to me for a second. For all of you who don't believe that this is serious, let's look at 3 days data. There was 5,400 people had passed from COVID-19 on the 13th of March. We're now at 7,200. There was 145,000 patients in the world. There's now 182,000. And keeping in mind, too, that China never reported the correct number. They lied like dogs. And Iran isn't either. So figure we're way beyond those numbers and death rates. But just those death rates alone, we're up 40,000 patients in 3 days, and we're up almost 2,000 deaths in 3 days. And it had been the week before, it took 7 days to get to 2,000 deaths. So it's going to start skyrocketing now. The other thing you need to realize for those in denial is 50% of the people in France who are on ventilators or intensive care are under 65. They're between the ages of 35 and 65. So half of that group dies too. So it's not just old people. Now the older people are going to die more often, but 20 to 25% of the people who are going to die are younger people. I mean, younger adults. I'm 55, so I think you're pretty darn young if you're 40 or 42. But for the COVID virus, you're not that young. So you have to keep that in mind. I'm just a statistics person. I'm just giving you the facts. And if you can't understand facts, I can't help you. But I'm trying. So the other thing to keep in mind is all of us are going to start being in a situation where we have exposure risk or get exposures. And so the thing to keep in mind about that is if you get exposed, you have to do a 14-day quarantine. It's going to happen to people. It's not their fault. It's not the fault of the person who exposes them. They didn't want to get the virus either and be at risk for death. So just be nice to them and be forgiving to yourself if it's you. I mean, no one wants to get this, but all of us are going to start having co-workers and situations where offices close, clinics close, businesses close because of this. There's nothing we can do about it, but it's about safety, and it's better to close something than keep something open. In Oklahoma, the update specifically is as follows. There are no tests available in the entire state. I spoke to David Chansome, who is the infectious disease head for the entire Integra system, Carl Ruskowski, Dr. Carl Ruskowski, who is one of the VPs at Integris, one of the best doctors on the planet. And the word is there are no tests anywhere in the entire state. So there's no testing here. Now, some of that probably is reflective of the fact our health department, our epidemiologists have not been perhaps had the support they needed from the state government or other issues, but our governor was kind of out there, Kevin Stitt, on making this not a big deal, which is completely an error, and he actually is starting to get excoriated nationally, which he deserves, as I mentioned last night, and I just have to smile a little bit about it, because when leadership fails, it can fail badly, and he's failed badly. And so we just need to, as a state, be focused on following good recommendations, limiting the number of people you're with, recognizing that keeping your distance, washing your hands, if you have access to masks, which we still don't have very much, wear a mask, and we can move forward. Additionally, the other interesting thing that happened today, and I'm looking at the little timer on this phone that's filming me and I'm going too long, I'm so sorry, is that the article on hydroxychloroquine or Plaquenil that showed that it was very efficacious against or potentially efficacious against COVID-19 got pulled off the NIH site today, which I've never seen in 30 years, so that was kind of strange. But it looks like the government doesn't want you to know that Plaquenil is super protective from, or is a potentially first-line treatment strategy against COVID-19. So if you're a at-risk patient, you're immunocompromised, you have bad lung disease, you have bad heart disease, you need to potentially think about calling your physicians and asking for a prescription. You'll probably need to be seen. Likewise, there's going to be some data evolution on hypertension management and the risks of certain drugs for COVID-19, but that's still in the works, and I'll update everyone on that in the next day or two. I don't want to get ahead of the current research, but there's definitely some concerns about which hypertensive medicines you're on and what the risks are for COVID-19. Finally, feel free to call your physicians for help or questions. If you're sick, stay home right now. Don't go to a ER. There's nothing they can really do right now. You just go to an ER if you start having lung problems or breathing problems. If you just feel ill, we have to wait another day or two before we have testing in the state of Oklahoma. And I believe we will have some by Thursday, Friday at the latest, and there'll probably be some drive-through spots. So that's the update for tonight. I hope this is helpful. I'm trying to do what I can to make people feel comfortable. We're going to get through this. Take your zinc, take your melatonin, take your multivitamin, stay away from people, wash your hands, and do what you can. But the vast majority of us will do fine. If you're on zinc and the melatonin and a multivitamin, you are going to be in great shape and be very unlikely to get all that sick. The melatonin completely interrupts the cascade that is responsible for the massive inflammation. So it's 9 minutes and 15 seconds. I went way too long. I'm so sorry. Anyway, have a wonderful night and a great day tomorrow, and stay optimistic.